Aspirin, a common drug to relieve minor pains, headaches, and fevers. Sometimes it's used as an anti-inflammatory and also a blood thinner. But could this drug do more? Low doses of aspirin have been recommended for individuals who have a history of stroke or heart attack. But according to Harvard, people who have no prior heart conditions will yield little benefit from this practice. Hi, how are you? We hope you're having a great day. Welcome to Scope Care, where we discuss health tips and other helpful tips to make your lifestyle better, healthier, and happier. For this video, we'll be talking about supplements and how they might not be as effective as we think they are. Before that, make sure to subscribe to our channel and turn on the notification bell. This way you'll get updated on our future uploads. It would also be helpful to give this video a like and share it with your friends. There's a lot to find out about the pros and cons of administering low-dose aspirin, especially when it comes to heart attacks. So, what are we waiting for? Let's begin! Aspirin, or acetylsalicylic acid, is a non-steroidal anti-inflammatory drug that is effective in relieving pain and fever. It's often used to treat mild to severe discomfort or to relieve the swollen, red, and painful tissues of the body. Aspirin is also effective in treating rheumatoid arthritis and even rheumatic fever. Due to its blood-thinning properties, it is also used to prevent blood clots, heart attacks, strokes, and certain types of cancer. While some studies have found that aspirin can lower the risk of heart attacks, experts still recommend that clinicians observe caution when prescribing aspirin as a preventative measure because it can increase the risk of bleeding and damage to the stomach. According to studies, low-dose aspirin, sometimes called baby aspirin, prevent heart attacks and strokes in people who are at a high risk of having them. Likewise, if you have had a prior stroke or a heart attack, your doctor may recommend that you take a low-dose aspirin every day to help prevent you from having another one. If you are pregnant, your doctor may advise you to take low-dose aspirin in the event that you have a high chance of developing high blood pressure, you have underlying medical issues, or if you've experienced any miscarriages in your previous pregnancies. Low-dose aspirin is available in the form of tablets, such as water-soluble tablets that dissolve in a glass of water, or enteric-coated tablets to help protect your stomach from bleeding. Unlike other aspirins that are available over the counter, low-dose aspirin is only accessible with a prescription. A low-dose aspirin therapy is occasionally used to treat children who have had heart surgery or who have an uncommon ailment known as Kawasaki disease. The use of low-dose aspirin in children should be limited to instances in which the doctor has prescribed it. In contrast to aspirin for pain relief, using low-dose aspirin to prevent heart attacks and strokes is not the same as taking aspirin for pain prevention. From what we can see, aspirin has several uses, some good and some bad. But what benefit does low-dose aspirin really offer for people who have no history of a heart attack? Short answer: very little. According to Harvard Health Publishing, taking low-dose aspirin to prevent a heart attack when you're 60 years or older may only do more harm than good. This information is based on research data which showed that for the vast majority of people without heart disease, the risk from taking low-dose aspirin outweighs any potential heart protective benefits. The recommendations are outlined, issued by the United States Preventive Services Task Force in October 2021. Even though aspirin can help prevent blood clots that can lead to a heart attack or stroke, the medication can also cause significant bleeding in the gastrointestinal system and the brain. These guidelines are not actually new to the majority of cardiologists in the field. In 2019, the American Heart Association and the American College of Cardiology announced guidelines that were identical to the previous ones, emphasizing that aspirin provides no benefit for the majority of people who do not have a history of heart disease. But for the majority of patients with heart disease, taking a daily low-dose aspirin is still a good idea. So, what are the side effects of taking low-dose aspirin? Before we continue, what do you think of the information we've provided so far? Let us know in the comments below. Next up is side effects. Low-dose aspirin, like other medications, may have side effects, but not everyone experiences them. As a matter of fact, 1 in every 100 people may experience side effects. Don't panic yet. Here are some things you can do to ease these. Mild indigestion. Mild indigestion happens when you take an aspirin on an empty stomach. To prevent this from happening, take your aspirin with your meals. If the indigestion still does not go away, it might be an indication that the aspirin has created a stomach ulcer. If this is the case, you should consult your doctor, and they may prescribe medication to treat your ulcer or switch you to a different drug. Bleeding more than usual. Because aspirin helps to stop your blood from clotting, it may make you bleed more easily. For example, you may get nosebleeds and bruise more rapidly, and if you cut yourself, the blood may take longer than usual to stop from oozing. So, be cautious while using objects that can cause an injury or a cut. Wear gloves when you work with sharp tools like scissors, knives, and gardening equipment. It may also be helpful to trim your beard using an electric razor rather than a standard one. Also, when flossing your teeth, try to just use the wax floss. If you experience any irregular bleeding while using aspirin, please make sure to seek medical attention. Although it is more rare, some individuals experience more severe side effects than others. Some people may cough up blood or have blood in their urine, feces, or vomit. The whites of their eyes may turn yellow, otherwise known as jaundiced. Some people even notice their urine getting darker, which may indicate liver issues. Others also experience sore hands and feet, which might be an indication of high uric acid in the blood. If you experience any of the side effects mentioned, call your emergency hotline immediately. Other serious side effects include stomach ulcers. Aspirin may also cause ulcers in your stomach or gut, particularly if you use it for a long period of time or in significant dosages. Your doctor may warn you not to take aspirin if you have a stomach ulcer or if you've had one in the past. If you're in danger of acquiring a stomach ulcer and you need a painkiller, take paracetamol as it is less harmful on your stomach than aspirin. Serious allergic response. In rare cases, some people experience an allergic reaction to aspirin, which can result in a life-threatening emergency known as anaphylaxis. Its telltale signs include developing itchy, red, swollen rashes, wheezing, difficulty talking or breathing, as well as the swelling of your mouth and tongue. When this happens, seek medical attention immediately. So what if you need to take aspirin but cannot take aspirin? Here's some news. There are alternatives. Instead of low-dose aspirin, you may be able to take another medication that helps prevent blood clots, such as clopidogrel, to treat your condition. These medications, like aspirin, work by preventing blood clots from forming and decreasing the likelihood of heart attack and stroke in patients who are at high risk of developing them. What drugs should you not take with low-dose aspirin? Taken together with paracetamol, low-dose aspirin is completely safe. However, you should not combine aspirin with other pain relievers such as ibuprofen or naproxen without first consulting your doctor. Aspirin, ibuprofen, and naproxen are all members of the same class of medications, known as non-steroidal anti-inflammatory drugs. Taking aspirin with ibuprofen or naproxen at the same time may raise your risk of experiencing unpleasant side effects, such as nausea and stomach discomfort. There are also a variety of holistic and herbal treatments that may not be compatible with low-dose aspirin. These treatments have the potential to alter the way that the aspirin performs, as well as increase your chances of experiencing negative side effects. Some herbal medicine, such as turmeric, have the potential to increase your risk of bruising and bleeding. Aspirin surely has several uses, but it sure has its pros and cons. If you're a healthy individual who isn't at risk of having a heart attack or stroke anytime soon, we suggest that you refrain from taking low-dose aspirin on a daily basis because it will likely do more harm than good. If you still insist, then it's best to consult a doctor first. If you learned something new, let's talk about it in the comment section below. Also, don't forget to subscribe to this channel and turn on the notification bell so you'll get updated of our future uploads. Again, this is Scope Care, and we will see you soon in our next video. Thanks for watching!